confirmed the first HIV transmissions linked to some popular cosmetic procedures. So far, the CDC says 3 women have tested positive for HIV after receiving so-called vampire facials at a New Mexico spa.
Go. Oh my god! Did you guys see this? Vampire facials are linked to HIV cases.
Vampire facial?
Yeah.
Like those procedures where they injected organ to the skin?
Yeah, exactly. Apparently, medical spa in Mexico was reusing disposable equipment, and 3 women were contracting HIVs.
That's terrifying. I can't believe people would risk their health for a cosmetic procedure.
Well, I know, right? It just goes to show that even seemingly safe procedures like this can be dangerous. I mean, who would have thought vampire facials can be dangerous?
It's really a reminder that we should be really careful about where we should go for our treatments. And we should do more about research on where we should go and make our treatments.
Absolutely. I think it's very important to us to be aware of the risks involved in medical procedures, no matter how small or minor it seems.
You're right. Maybe you should just stick to natural beauty routines for now.
Yeah, maybe that's the best option.
Let's go, guys. Ready, 5. Quick, quick. Okay. Guys, goodbye. Bye, guys.
Bye!
As a medic student, we're also at risk of infections due to our laboratory. This means we must be cautious with our tasks.
You're right, and by doing that, if we are taking our work carefully by protecting ourselves, we are also protecting those who rely upon us.
But how do we really, safely, and ethically work on labs?
According to Eugene Brianna, clinical laboratory safety directly affects patient cares. Errors or accidents in the laboratory can lead to misdiagnosis, delayed treatment, and or compromised patient outcomes. So here's how it is.
Tip number 1. Ask yourself, what am I working with? What are the hazards? It is really important that you are fully aware of what will be working inside the lab, whether it is animal, biological, chemical, physical, or radiological.
Tip number 2. Be prepared. Be alert and proceed cautions at all time in the laboratory and immediately notify the supervisor for unsafe conditions. Know all the emergency response procedures for accidents or injuries in the laboratory.
Tip number 2. Prevent potential exposure.
Dress for work in the laboratory. Wear clothing and shoes that cover exposed skin and protect you from potential splashes. Tie back long hair, jewelry, or anything that may catch in equipment. Conduct yourself in a responsible and professional manner at all times. No pranks, no practical jokes.
Tip number 4. Protect yourself, others, your research, and the environment. Practice good personal hygiene. Wash your hands after removing your gloves before leaving the laboratory and after handling a potentially hazardous material. While working at the laboratory, wear your laboratory coat and gloves as directed by your supervisor. Properly segregate and dispose of all laboratory waste.
There's no better feeling than knowing people who can help you medically are well educated and up to date on the latest advancements and treatments.
You know you're in good hands if your physician is board certified and has years of experience in this field.
It is therefore important to choose a medical center that hires only licensed and trained medical practitioners and can offer you quality services and health treatments.
Such individuals would most likely possess advanced degrees such as Masters of Science in Nursing, Doctor of Dental Medicine, Doctor of Medicine, and etc.
Board certifications,
Licenses from the appropriate regulatory authorities in their respective jurisdictions.
patients' reviews and testimonials,
Patient safety record and infection control protocols.
technologies and facilities.
Laboratory safety is not a singular objective that is completed and accomplished. Rather, it is an ongoing commitment to the functioning culture of safety that demands constructive education and continual improvement.
We must work safely to protect each other, the public, and the environment. Everyone's safety is dependent on your commitment to a strong safety culture.
By utilizing safety work practices and equipments and constantly looking out for safer work to do our jobs and to protect the people and our neighbor from every hazard that we encounter in our laboratory every day.
So yes to hashtag precision in every step, safety in every hand.
You want?
Yeah.
3, go.
You're right. Go.
Laboratory safety is not
Uy, sorry, ano ka na? Mali, wala tayo.